Welcome to Live from HCIC 2023, a podcast series bringing you front row insights from the industry's brightest minds. In this 12-part series, we delve into the heart of the trends impacting health systems with leading experts, senior executives, and thought leaders, as recorded live at the Healthcare Internet Conference in November of 2023. This series is brought to you by Greystone, Bowstring Media, and Touchpoint Media. Listen in as we hear from our industry leaders on the latest innovative strategies and efforts that are shaping our space. I'm sitting here with Daphne Tam. I'm excited to have this conversation with you today. Thank you for joining the recorded live at HCIC podcast. A little bit of buzz around us. We're recording live from the expo hall. But thank you for joining today.
Thank you.
I'm excited for this conversation here today, but before we get into it, I'd love for you to share a little bit about yourself, maybe your background, etc., with people watching and listening in.
Yeah, so my name's Daphne Tam, and I lead marketing communications for Southwestern Health Resources. And we're a clinically integrated network, which is a total different animal than most of healthcare systems out there. We are basically a network, a child organization of UT Southwestern, which is an academic medical center, and then also Texas Health Resources, which is one of the largest faith-based health systems in the nation. But we started basically as a little ACO from both care organizations, and we kind of grew over time. So we're a network of 7,000 providers. A lot of them are independent primary care physicians, but also specialists in North Texas, but also the providers from our parent organizations. And then we also have things like SNFs, we have home health, and we have other services that are kind of wrapped into it. In addition, we also have a Medicare Advantage plan that's kind of part of our organization too. But I've been in healthcare for a long time, mostly in the health system world. So this is kind of interesting, going into more of a value-based, system-focused organization versus a lot of us are still, even to this day, our parent organizations are in fee-for-service, but it's a different mindset.
It's a different mindset, and that perspective is going to be really helpful for today's conversation because, it really kind of aligns with how we're seeing the role of marketing communications within the health system, which is a complex, many different angles to it. It's shifting a little bit. And in this particular case, I want to kind of drive in a little bit on this value-based care, which we all have heard. Our industry's changing.
Sure.
What we have to do is changing. It's almost like as a marketing communications professional, while you have your unique focus, even if you're in a health system, you're starting to think about, I have more than just patient acquisition to worry about.
Yeah.
Now I have to start thinking about our patients as being members of our organization, right? And so we were talking just before we started recording about, I kind of see the world as I wouldn't say the world, but I see our marketing audiences that we're trying to reach now kind of align into three different buckets. Of course, new patients, patient acquisition, that's kind of an important piece of this. But then you have your existing patients, understanding them and engaging with them a little bit further and to make their experience that much better and help and with interventions. And then you also have those patients that are at risk, maybe not closely associated with you, but you need to know them and you want to bring them in. You kind of spend your time a lot in the latter two halves of this, what I described,
absolutely.
right? So let's get into that a little bit.
Yeah.
So as I describe it, I made it very simplistic, right? These three different major audience groups of patients.
Yeah.
How do you see it? Do you see it the same way?
I see it the same way too because, our providers are out there. We have two famous parents that have patients who are coming into the network. A lot of the patients in our charge too are coming from the community with our independent physicians. But once they're in our network, absolutely what you were talking about, how do we keep them engaged? How do we prevent them from getting diseases in the first place? But for those who are at, I would say, rising risk or have some type of chronic disease like diabetes and healthcare, they really do need interventions along the way to keep them healthy within our network. And so a lot of that, the same principles, where do you get that information? Where does that relationship start? It starts from our providers. So what we do is we arm our providers, like our primary care physicians, with information, with data, and also with services to really help them take care of their patients better. And what I mean by data is how are they really doing? We are providing our our primary care physicians with EMRs, as far as subsidized EMRs out there, so we're able to collect the data. We're using also predictive analytics, understanding like, hey, this person is at risk. And so, or let's say they need their annual wellness exam, they need their mammogram. So if we provide that information to the PCPs, they're able to take care of their patients better. And then that way they don't get in the ED or, in a worse situation than they need to be.
Right.
Yeah.
So it's interesting as you describe this, right? As you're describing this, in my mind, that isn't something that I would typically associate with a marketing communications role, right?
Yeah, no.
Because that seems like more of an operational or maybe even, social determinants of health or community care and et cetera. But I do, as you describe this, Daphne, right? You're talking about using EMRs. It's almost like that EMR is your data source, so you could start to understand those community or those patients in your network better.
Yeah.
And then provide the interesting information for intervention. It is a marketing discipline that you're doing, that you're applying, right?
It's a lot of, I would say, understanding how that journey looks like in order to create the materials, in order to help our providers educate their patients better as far as like what they need to do and making sure that those touch points are in place. A lot of what we do in marketing too is, at least at Southwestern Health Resources, is to help those providers understand why they need to be part of our network.
Yeah.
And the reason why is that we can actually alleviate a lot of the headache, the administrative burden, which I think a lot of providers are feeling out there right now.
Right.
So much more pressure. Like, what's this whole thing with value-based care? I don't understand. I just want to take care of patients. To be able to bring them into our fold so that way we can arm them with all the things that they would need to take care of the patients better, right? So it's like I was saying, like the data insights, participating even in our contracts too. So when we had basically started as a network, we knew that we could provide all these services to our providers, but I don't think they really understood what the value was. And so that's part of what we do in marketing, is to help them understand, hey, like we can help you do the things that you don't want to do, so that way you can focus on your patients.
I mean, to me, as you're describing this, right, it makes complete sense. But again, in my 15 years in healthcare, in a marketing role, this is something that feels a little bit net new. Did value-based care drive the need for this, or this concept of like memberships and other things? This has been something in place like with payer organizations and others for a while now.
Exactly.
So tell me a little bit about how you're looking at this in the context of what you're doing, because you're not unique.
Because we're not a payer, and we're not a direct healthcare provider, but we're, I would say, the engine behind all of the things that can help, I would say, keep people healthy.
Right.
Because we're not looking at it from an angle of, hey, we're trying to make money off of this. The money that is being saved from taking care of the patients in a better way actually funnel back in to the system to be able to do things even better, to make it more, I would say, more nimble as far as like how we provide good care with quality outcomes. Because in the world of fee-for-service, you're looking at, basically episodic care. How do we get people in?
Right.
And that's how we get paid. But as you know, healthcare in the U.S., we're spending so much money, yet the outcomes aren't really there. So how do we focus on making those outcomes better?
Right.
And a lot of it is really making sure that people are getting to the right place, the right time, for the right care. And that's a lot of education. That's a lot of awareness. And you want to still get those patients into your system. So there's still the acquisition piece of it.
Right.
But now it's more about engagement. It's more about like, hey, do they have the information that they need to? Mm-hmm. So at the end of the day, we're not just basically, just kind of, making them worse health-wise,
right.
But then also they're getting the right care.
And I like the concept, right, that you said that it's almost like a reverse ROI equation if you think about it.
Exactly.
Because you're saving money on long-term care for these individuals.
Exactly.
Which, is really the purpose of what we're trying to do as marketers. I get it, driving in new patients. Don't get me wrong, that's good. important part of the business. But in this particular case, I feel this is like a more closely aligned to their care and really helping to improve the health of our covered lives, right?
Yeah.
Again, I'm using a payer term, but it feels.
I mean, but if you think about payers, right, with Centers for Medicare and Medicaid, I mean, really, they're giving you here is your charge. You're taking care of these folks. The more money you save, the more money it goes back to the providers for taking care of those patients in the proper way.
Yeah.
I mean, that's basically it.
Yeah.
And so you see even payer models out there too, or, I would say some of the health plans that we know of, they're trying to use those same models in taking care of their patients.
Right.
Well, one thing that was really great about, the ACO that we now participate in, which is ACO REACH, is there's the equity piece, the health equity piece in it too, which touches on social determinants of health, which is like 80% of what happens in you and your wellness takes place outside of that place of care within, let's say, your doctor's office or whatnot. And a lot of that has to do with, access to nutritious food. Do you have transportation? Can you pay your rent? And so really looking at this more holistically and working with even different, I would say, agencies out there to kind of help individuals. If we're able to do this right, then at the end of the day, people do get better. It's not just like, hey, I got to go into the doctor's office or the ED each time in order to be well, be good. Because a lot of those factors, it's not within even the provider care space.
Right, exactly.
Yeah.
I think that's also important, right? As I learn more and more about like community interventions, and
exactly.
It reinforces the mission of us as health institutions. That's what we're trying to do, to improve the care. But this kind of extends our impact and our reach as communications and marketing professionals. Now, you shared a really great example yesterday on stage. Do you want to share a little bit about that with people listening?
Oh, yeah. So we did a program, and it's called ED Diversion. And basically, as you know, the emergency room is sometimes the first choice as far as a setting for patients to come in for care. And the fact is that 1/3 of emergencies, or I would say emergencies that are being seen in the ED, are not really true emergencies. And it's really expensive for care too, for a lot of those folks. And so we were looking at why was this happening, and a lot of it has to do with awareness or education, like where else do I go for emergency care? Okay, and the second might be social determinants of health. I mean, honestly, do they have lack of transportation?
Yeah.
I mean, or, do they not know where to go? Or maybe they don't even have insurance. And, emergency rooms obviously cannot turn people away.
That's right.
Yeah. So when we were looking at this, we were like, well, maybe there is an opportunity here for the educational piece. We know that as healthcare systems get more strapped, there must be a way for us to be able to really target the individuals who need that help, those interventions ahead of time before going into the ED. So what we did is we took a look at our patient population. We figured out that the top 5% of our rising risk patients who had things like perhaps a heart situation going on, maybe they actually take certain meds. And the reason why we were looking at that, if they weren't taking their medications or had medication adherence, maybe that's why they're going into ED. And then also looking at the frequency of how they've been going to the ED for the past 6 months. We took those patients and that patient list, and we provided a toolkit for our providers, and we gave them educational materials as well, so that way they'd be able to outreach to their patients and making sure that they know, like, hey, this is where you actually go for emergency care if you need it.
Mm-hmm.
And so we had a flyer with QR codes, and most of our patients had mobile phones, so they were able to know where to go. They had a list of urgent care and other options, telehealth if they needed it. We also have wraparound services for our providers too, which is care managers that coordinate care.
Okay.
We also have social workers too. If some of these patients, a lot of them have been flagged for social determinants of health, like let's say they had some issue with transportation, or they lived in a food desert, we actually have social workers that go into their homes to check out how things are going, or they had a fall risk. So that's how we created these, I would say that's how in the first 6 months of really launching this, we were able to reduce ED visits by 2%, which sounds really little.
Well, in 6 months, you said.
But in 6 months, that's a big deal.
That's profound.
It is, and it saved $2.5 million that went back into the system to really take care of these patients where they needed to for other interventions versus going to the ED for all of this care. So, the quality scores went up. It was a great.
And you also had quality scores go up.
Yes.
So I will say this, not disparagingly for my, traditional marketing colleagues in the space.
Sure.
Not many of them can say they launched a campaign and in 6 months saw a $2.5 million return on investment.
Yeah.
And this is one, like a great use case, right? And you're using similar tools and approaches that
QR codes, flyers. We have other things too, like emails that we send out or other, there's outbound calls that go out to these folks.
Right.
But yeah.
It's kind of shifting that whole concept of what marketing in healthcare really is. And I talk to my, people that are not in the industry and they say, well, what do you do as a marketer in a health system? And a lot of times they don't understand the term. I think there's a misnomer around the term marketing or communications. Well, it's more of a discipline. It's more of like, how do you understand your audience better? How do you identify, you said, right care in the right place at the right time? We think about that. We talk about that with digital advertising to reach new patients. You're doing it for existing patients or patients that are potentially at risk.
Well, you think about the journeys that people have. That all of those things are transferable to even points of care or just trying to engage patients out there to be well at the end of the day.
And a lot of health systems right now are kind of managing that because we know we're going from a fee-for-service to a value-based care model. Mm-hmm. That's happening. It's going to happen even if you don't have a network such as yourself that's more formalized and established. Even small community hospitals are facing us. So, as there, some of those people may be listening or watching us right now, what would you say to them? Like maybe they don't have kind of you, which is a shame. Can we replicate you and pretend everybody else? But, how would you suggest they kind of start to put their arms around this and think about this?
Yeah, that's a good question. Really understand, because I didn't know really that much about ACOs or value-based care, what the aim was. I would say that as we go more from fee-for-service into value-based care, what does that really mean as far as taking care of those patients? What types of disciplines, like you were saying, could be applied to some of the same thinking too? And in value-based care, since we're looking at outcomes versus just heads and beds, how do we keep those individuals well? Mm-hmm. And if we do, then we see more money at the end of the day as far as going back, or we get to save that money or get to keep that money within our organizations. I think some of these things and understanding how that works is really important. So I would just say, hey, get to be more familiar with value-based care and what that really means to us as marketing communications folks.
Right.
Yeah.
Well, and the success measurements change.
It does.
Right?
It really
but
does.
The underlying skills are still the same.
Same thing.
You don't need a marketing CRM.
Nope.
Now you need to look at what's going on in your EMR and parse that data in a way where you can actually start to understand and measure success.
And we're talking about as part of there used to be the triple aim, right?
Yeah. The triple aim.
The triple aim that we heard about healthcare improvement, right? It's but now then it became the quadruple aim, adding physician experience as part of that. Right? It used to be, basically cost of care, patient experience and whatnot. But now there's actually 5 aims. The 5th aim in there is also social determinants of health, or health equity, I should say.
Health equity.
Health equity. So being more familiar with those things, you'll start to see how healthcare is being paid for, which at the end of the day really impacts our organizations and us as marketers, and being able to kind of start thinking about what are some of the messages, what is some of the messaging that's kind of involved in that too. And we may be pulled into more educational things or community partnerships out there to kind of help take care of our patients better. So I would say a lot of those things, I think, would be good for us as marketing communications folks to understand.
Get to know the quintuple aims.
Get to know.
Is that what they're calling it now?
It's quintuple aim.
Yeah.
I hope it doesn't become 6-pronged.
Oh, could you imagine? Sextuple? Oh, anyway. Daphne, this has been a really interesting conversation. It's kind of energized me a little bit. I'm excited about this because this is really fascinating. I don't spend a lot of time in worlds like yours, but it's exciting to me because I can see the transfer, the movement from fee to service to value-based care. It's not that daunting, right? It's just you have to understand your different goals and your different approaches.
Exactly. But at the heart, we're all pretty much the same. We're talking about experiences. We're talking about engagement and all of that. Yeah.
Thank you so much for your time. It was so great to chat with you today.
Yeah, same here.
Thank you for watching live from HCIC 2023. We hope these insights have sparked new ideas and conversations. A special thanks to the industry experts featured on our show, and to Greystone, Bowstring Media, and Touchpoint Media for making these discussions available. For more episodes and exclusive content, please visit Greystone.Net, Touchpoint.Health, or subscribe through your favorite podcast listening platform. If you want to be part of more conversations like this one, please make sure to attend the Healthcare Internet Conference in Austin, Texas. You can find more details at hcic.net.